Helping toys in emergencies get the help they need is something I know a lot about. My friend Hannah knows someone who also understands how to handle an emergency.
Hi, Doc. Meet my mom. She's an emergency room doctor.
My name is Maisha, and as an emergency room doctor, I take care of people who don't feel well and need to see a doctor stat.
Just like stuff is.
We'll take you right away.
Exactly. But instead of toys, I take care of people. The best thing about being a doctor is being able to help people feel good again so that they're healthy and happy. That makes me happy.
That sounds like an important job to me.
How did I become an emergency medicine physician? Well, I graduated from high school like most students in our country, and then I selected a college that I knew would get me into medical school. I went to Xavier University of Louisiana. I did well there. I majored in chemistry. I took a lot of science and math classes so that I could do well on the MCAT. I was accepted into Tulane School of Medicine early, so I didn't have to apply to a bunch of medical schools. So I actually only applied to UCLA and USC. I was almost immediately accepted into USC, so I actually withdrew my application from UCLA. I absolutely loved USC School of Medicine. I graduated with lots of accolades, and then I went on to residency. My last year of residency, I was selected as a chief resident, which was quite an honor, and the first woman in the history of the program to do so. The cool thing was, I was the only woman in the entire class, and I actually had a baby when I was a resident, so that was a big deal. During medical school and immediately following medical school, there's an exam to take with 3 parts, the USMLE. You got to do that. And then in residency, every year, there is an in-service exam, which is like a practice board exam. You got to do that. And then after you graduate from emergency medicine residency, you are eligible to take an exam, which is a written exam called the qualifying exam. And what this qualifies you to do is, if you pass it, to go to Chicago and take an oral exam. And the oral exam is when you are in a hotel room with examiners and basically they're throwing questions at you, emergency medicine questions. What would you do if this happened? What would you do if that happened? They give you multiple cases and you have to manage all of these cases out loud to an examiner. And if you do that sufficiently well, then you get to pass that exam and call yourself a board certified emergency medicine physician. Because emergency medicine is so versatile, there are many things that I get to do with my medical degree and my broad-based training. I have community clinics, I have occupational medicine clinics, I have a home health practice, and all of this I'm able to do with physician extenders, which are nurse practitioners and physician assistants. I also do integrative medicine myself. I have a special interest in integrative medicine and think that that's the way to stay healthy. I would rather keep people out of the emergency department with healthy living by intervening before they have to see me in the emergency department. So I really enjoy that aspect of my practice. I also prescribe medical cannabis. I review medical records. I am an expert witness in cases that involve emergency treatments like car accidents or occupational traumas, workplace hazards, workplace injuries. I engage in dialogue on behalf of the patient to explain to people their injuries so that they get the compensation that they need and the treatment that they need. And all in all, one of my favorite things about emergency medicine, if I'm being honest, is to me, it feels like I am the quintessential doctor. When I was a little girl and I wanted to be a doctor, what I imagined in my mind was exactly what I'm doing now. I know a little bit about a whole lot of things. So anytime somebody asks me, what do you think about this? Skin, babies, pregnancy, headache, trauma, burns, you name it. I kind of have an idea about what's going on. I know how to put all the pieces together. I may not be an expert in that particular field, but I know enough to know when there's a big problem happening, because that is my job, and to make sure it doesn't turn into a life or death situation, which is really what most people want to know when they call up a friend that's a doctor in the family and say, hey, what do you think about this? They're not always looking for you to have all the answers, but really what they want to know is, do I need to go to the emergency room, or can this happen over the next weeks or months while we tinker around in clinic with my primary care doctor and try to figure it out?
When I was a little girl, I wanted to be a doctor too.
She's an emergency doctor. When there's a really big ouchie, she's the one who makes you feel all better.
Sometimes big boo-boos need to be treated right away.
We've got an emergency, everyone. Oh, my.
When children come to the emergency room, I try to make them feel more comfortable by talking to them so they understand everything that's going to happen.
Doc's gonna take good care of you.
So for me to have the training, the ability, and the knowledge of an emergency medicine physician allows me to engage in these dialogues with people in a way that's very, very satisfying. So for me, emergency medicine is the perfect specialty. And I am so happy to share just a little bit of what some of us do with this credential.